My whole goal with this video that it'll make it to the one person that needs it, the person that is dealing with mobility issues and feels that there is no hope. Hey y'all, it is Kandi. Thanks for joining me on my channel. I wanted to do a video today to let you guys know an update on my journey working with Dr. Sean O'Mara and having MRI scans done so that I wouldn't be able to see exactly what I'm dealing with as far as visceral fat, fat around my heart, how big my muscles are, how much fat is inside my muscles, and all that good stuff. So let's start at the beginning. I have been on a weight loss journey forever, as long as I can remember. I have never been athletic. I have never been able to run. I've always been awkward dealing with problems where I get exhausted the minute I start working out. Ever since I was a little kid, my parents would drag me into the doctor because I was always falling. I couldn't run. I couldn't keep up with the other kids. And probably I could remember about 3 times they brought me into the doctor and the doctors would just say I'd grow out of it. So this has really gone on my whole life. Climbing stairs was hard. Getting up from a seated position was hard. The older I got, the worse it got as far as climbing stairs, getting up off the ground, things like that. So roll back 3 years ago, I was almost 47 years old, and I decided to pursue the reason why I was having these issues with my muscles, in particular my legs. I was convinced that I had some kind of muscular dystrophy. I just would never get any help from doctors. When I first started trying to pursue it really hardcore to see what I had, because I know it's not just in my head, that neurologist told me that why would I need to know that it was just a muscular myopathy and we may never know what it is. And the only reason why I would need to know is because if I'm afraid that I would pass it on to my children. And since I'm done having children, it didn't matter. So this was really disheartening that yet I'm brushed off again at, almost 47 years old. And I decided to change insurance companies. Long story short, finally got a new insurance, finally got a new doctor, and they started doing some testing. And they found out that I had spinal muscular atrophy. So the type I'm diagnosed with is spinal muscular atrophy type 3. And what it is a genetic disease where I'm missing a gene called the SMN1 gene. And I have 3 copies of something called the SMN2 protein. So with SMA patients, the more SMN2 copies that you have, the better off you are. So for me, I can still walk. I'm still mobile. My biggest hurdles are definitely walking upstairs. I have a really hard time with that. Ramps are better, but I still have, muscle cramping as I start to walk up the stairs. I'm getting up from a seated position, especially if it's really low or if the floor is slick. That is a hurdle for me. Getting up off the ground. I try not to sit on the ground. I am now because I'm hiding from my dogs who are going crazy. So I'm in my workout room right now on the ground, but I have things in place that help me get up from the ground when I'm in here. I had started hearing about Dr. Sean O'Mara on YouTube and just looked more and more into him, decided that I was going to look on his website. I did message Dr. O'Mara from the website, let him know that I have spinal muscular atrophy and I'm interested in his program and what would that look like for somebody like me who has spinal muscular atrophy who cannot exercise like he recommends. So Dr. O'Mara got back to me pretty quickly and he told me he's interested in working with me, that he had not worked with any SMA patients. So I decided that I was going to make the trip to Minnesota to establish him as a doctor and to get my first set of MRI scans done. I had 3 sets of MRIs done in April. I think it was April 15th. And I had them of my brain and my abdomen and my legs. Those MRIs I had done in the morning and then immediately from there traveled to Dr. O'Mara's practice and had a meeting with him. He did let me know that my composition of my visceral fat and the fat inside my muscles especially was the worst that he had ever seen. And he had never worked with a spinal muscular atrophy patient, so he didn't know exactly what he was in for when he looked at these scans. So needless to say, he was pretty shocked. I was pretty shocked. I already knew it was bad. I could tell just because my physical mobility is declining a little bit. So that was the middle of April. So after I left his practice, I was pumped up. I was ready to go. Let's tackle this thing. At least now I know what I look like, so I have some kind of starting point. Because up until that point, even with dealing with spinal muscular atrophy, these doctors do not take any kind of images of your muscle composition. They don't offer anything like that. There is no cure for spinal muscular atrophy, but I do get treatment. So every 4 months, I get a lumbar puncture and I get a medicine called Spinraza injected directly into my spinal cord. So that will take place for the rest of my life. It's not a cure. They specifically let you know that it's only to help stop progression and not to reverse anything. So I was just curious, like if I really try, if I really put my mind to it and focus on eating clean foods, focus on exercising and things like that, can I get better? Can I stay the same? My whole goal is to stay out of a wheelchair, basically. If I never get any better than I am right now, I'm okay with it. I can move on my own. I can walk on my own. The things that give me struggles are stairs, but there's things in place for that. I can take a ramp, or a lot of places have elevators. So as long as I'm able to just take care of myself and keep my mobility, that is all I ask for. Anything else is a plus. When I very first left Dr. Amar's office, I was pretty pumped. I was ready to tackle this thing. I finally knew what I was dealing with specifically, the muscle wasting, the fat that I have inside of me. So I really was pumped to at least have a visual. But then when I got home, I kind of got into a funk. I still was doing his protocol and I was eating carnivore. I was eating a little bit of fermented foods, but I was in a funk, I started, I don't know. I can't even explain it. I just kind of got into a funk. That lasted for a while. I had not given up diet soda was one big thing that I had not done. I was still drinking the artificial sweeteners and having sweeteners in my coffee. And at the end of May, I did go off the wagon for about a week and a half, and it was not a pretty sight. I started feeling sick. I started aching again, and I got back on the wagon after that, and I have not looked back since. I've been going hard, trying to do everything that I can to fight this disease that I have, and to increase my muscle, and to decrease my visceral fat, and to decrease my myosteatosis, and to decrease the fat that's around my heart. So I am faced with a big task of getting all these things tackled. Last Tuesday, it was September 3rd, I went and had my MRI scans done again, and he read my results. He sent me a video, and I'm going to link that video right here.
Hey, Kandi, excited to be able to do your video follow-up analysis of what you've done inside your body since you came to see us and work with us. So going back to April, we're going to show you your scans, and by convention, I always put the baseline, the oldest scan at the bottom and the newest one at the top. So here is your right lung, your left lung, and right in the middle of your lung is your heart. Surrounding your heart when you came is this large chunk of fat around your heart. Now, a fair number of people most people have a fair amount of fat around the heart, is what I'm trying to say. In your case, you were no exception. You had a large amount of fat that you had around your heart. Now, in this case, though, what happened is you reduced that fat substantially around your heart at the same level. And you also have a fair amount of fat around your aorta. And so in this case, we see reduction in the fat around your heart. That's good, because this fat that's around your heart, ectopic fat, mediastinal fat, is very inflammatory. So we're starting at that level because we're up high and we're going to scan down your abdomen. So that's one of the first views that we get of a client. So right away, between April and recently here in August, you, in about a little over 4 months, 4.5 months, you've reduced a significant amount of fat around your heart, which is great. So that reduces your risk for heart attacks, and it's also a proxy for visceral fat and deep subcutaneous fat and these other deadly inflammatory fat depots inside your body. So great, happy to report significant reduction in your cardiac fat. All right, now this is your abdomen. We're at the level, people wonder, where are we in the abdomen? So this is like you cut a body in half, right at the belly button. See your belly button? So we're right at the same spot. We like to get the same level so we're not comparing apples to oranges. We're going apples to apples. So this is your abdomen when you came in here. This is your abdomen today. This is your spinal, most recent scan. This is your spinal column or your vertebral bodies. And I measure the distance here in your kidneys, because your psoas muscles are so small, don't have a real good reference point to measure those. So the distance there is 74 millimeters, and now you're down to 65, reflecting that in the sagittal plane, which is this distance here, sagittally, you've reduced your visceral fat. So you do not have as much visceral fat as you had formerly, so you're starting to become more oval, which is great. How much? I'd probably estimate about 20% reduction in your visceral fat. Normally, I like to see 30%, but in your case, because you have SMA, I think your ability to eliminate visceral fat is more challenged by that genetic condition. So spinal muscle atrophy is going to make, I think, my first SMA patient is going to impair your ability to get rid of visceral fat. But despite that, notwithstanding that, you have reduced your visceral fat and you reduced your cardiac fat. So I'm super proud of you, super proud that you're able to do that. So excited about that. And let's go on to your next scan, which is again a little bit lower in your abdomen now. We're below your umbilicus, and I want to point out a few things to show there. You've reduced your larger amount of visceral fat. You've reduced it there. We're still at the level of your liver and your kidneys. You can see that distance is smaller in the sagittal plane, and you're larger here. But I also want to look at this distance here. This is scarpus fascia, which defines and separates your subcutaneous fat into two compartments, the bad guy and the good guy. The bad guy is deep subcutaneous fat, okay? It runs from that scarpus fascia to the deeper tissues, okay? Deep subcutaneous fat, and I drew a little red there to help point that out. The good guy runs from scarpus fascia to the skin. That's superficial subcutaneous fat. One's inflammatory, causes disease. The other one's beneficial, releases adiponectin, adiponectin, which reverses disease, lowering your risk for mortality and heart attacks, strokes, diabetes, fatty liver disease, Parkinson's, neurodegenerative diseases, and even obesity. So we want to keep this and we want to get rid of that. So the more of this you have, the more of this you have, and also the inflammatory fat that you have in your muscles, okay? So we see your muscles around here. Your muscles appear to have gotten a little bit bigger in this particular scan, and you don't seem to have quite as much fat in your muscle in this particular image there. Now keep in mind, a little bit of difference could make the optics on it, but we're going to look at your muscles in a greater view in another level. So just a small indication that your muscles seem to have grown a little bit in this scan here, and they look like you have a little bit less fat, than you had formerly in your abdominis rectus. So that's good. And we hope we see this trend continue on. But look at your deep subcutaneous compartment, how much you improve that. So that only happens when you lose deep subcutaneous fat from also losing visceral fat and muscle fat in all examples. So the fact that we see this reduction is further evidence that you're losing your muscle fat and your visceral fat. So I'm excited about that. Let's get into legs, okay? By way of reference, if you remember, the association of muscle fat is seen with visceral fat. So this individual here has a lot of visceral fat and they have a lot of muscle fat. The technical term for that is myosteatosis. So they have infiltrates, fat infiltrating, invading, replacing their muscle. And the more of this, the more of this, and the more of this, the more you see that in legs. So this guy's legs should be all dark like this guy's legs. But this guy looks like Wagyu beef because he has so much visceral fat in there. So as visceral fat goes, so do the legs. So it's a good example, a good proxy for looking at visceral fat, myosteatosis, fatty infiltrates, what's going on in the legs. So this guy here has almost no visceral fat, okay? Very, very little. And so as a consequence, their muscles are nice and big and lean because they don't suffer the ravages of sarcopenia, loss of muscle mass, and that fatty infiltrates within the muscle. You see it's nice and dark, and it's reflected again in their legs. Nice dark muscles without all of these white spidery, looks like road maps, Wagyu beef. Again, you don't want to be Wagyu beef. Now, in your case, unfortunately, you look like your legs look way higher, like you have a lot more myosteatosis when this is when you came, okay? Now, there's a little bit of a sequencing different because of a different scanner, a slightly different protocol. So your muscles look dark, and all that white is fatty replacement of your muscle because of your spinal muscle atrophy. So your muscles are atrophying as this fat is replacing them. And these are sadly, were the worst legs I've ever seen of anybody who came to me. So, but let's compare it to your repeat. It's a different sequence on a different machine, but we can see these muscles, and the fact that it's darker, down here does not necessarily mean that you have less muscle. It's not quite in focus. So let's focus in on this particular area here that I've circled, okay? So what we see here is not as much muscle here, and look what's starting to emerge here. Muscle. So I'm very excited that we see this development of additional muscle. Now, were it dark, like these same areas right there, if this was as dark, this would be a lot darker in here. And we just don't see that. So I'm super excited that this looks real, and I had it read by a body musculoskeletal radiologist who specializes in it, and they agree too that you are putting on muscle. So I'm super excited to report that. It's not just me, because I don't have as much experience reading spinal muscle atrophy patients as this person does. So we're both thrilled for you and just super excited to be able to report this. This is the confidence that comes from using an MRI. You're just not going to see this in labs. You're not going to get this in a cholesterol panel. So all your hard work doing the 48 strategies that we figured out, how to get rid of visceral fat, myosteatosis, fatty infiltrates of your muscles, are working for you. So don't you dare stop working those strategies, okay? This is you in a little over 4 months. Let's see this again. Just keep doing this, and I hope to be able to share this. Use your example to be able to help encourage other people that have this, suffer the ravages of this terrible disease. So now we can give you some hope. We want to, encourage you, and I'd love to hear back from you. If you have any questions, just shoot me back a little audio or text me, and I'd love to answer those questions for you. All right, great job, Kandi. Excited to be able to continue to work with you. Thank you for having the confidence to come to me and be brave enough with your condition to come forward and give this a try.
So as you can see, I had some improvement. I am very happy with that. I did not expect it to be as good of an outcome as it was. You know, if you're told you can't do something, then a lot of times we don't even want to try. And I am very excited that following his protocol has resulted in a loss of visceral fat. It has resulted in a loss of fat around my heart. And it looks like I'm building some muscle. Even though my muscle doesn't look anything close to a normal muscle, it's increasing and my myosteatosis is decreasing. So I am so excited to report that, you know, things are possible. My goal with this video is not for YouTube views. It's not for clout. It's not for bragging rights. My whole goal with this video, that it'll make it to the one person that needs it, the person that is dealing with mobility issues and feels that there is no hope. That if somebody out there is being told that they cannot get any better, I hope that that person finds this video and that person would be encouraged to try. If you don't try, you're not going to know. And I was told that it would never happen, and it is happening for me. So regardless of what you're dealing with, whatever kind of mobility issue that you are having, please don't give up on yourself. Start eating a clean diet. Cut out the processed foods. You can implement Dr. Sean's program without having to pay a fee to see him. If you want to see your MRIs and want that extra motivation, by all means, contact him. But if you don't have the money to do that, or you're just not quite sure, now besides the cost of the food, it won't cost you anything else just to start eating a carnivore diet and to start eating a little bit of fermented foods. You know, things may not be reversed completely depending on what you have, what you're dealing with, but there's hope. Don't let anybody tell you that something can't be done. You know, I was told that I was never going to grow muscle, and that happened for me. After being brushed off from doctors my whole life, by the grace of God, I finally found Dr. O'Mara, who actually took time to talk to me and to give me some strategies that I could use to fight this disease that I have. He's never had training on spinal muscular atrophy, but what he had was a drive to help me, and he had a drive to help me get better. So I just hope that whoever needs to hear this message hears this message. There's hope for you. Do not give up on yourself. Well, I hope you found some encouragement from this video. Thanks for joining me today, and until next time, stop eating processed foods.